In the state of Kentucky, there are 120 different counties. Of these 120 different counties, 87 of them are considered rural or underserved areas. Because of this, there tends to be areas within these 87 counties that don't have the healthcare access that they need. This leads to higher rates of disease, less education resources, and a variety of food deserts as well. I'm Kirsten King, and I am a graduate student here at American Public University, and I wanted to study whether the social determinants of health could play a part in determining whether there are racial undertones within public health. So what I did is I compiled many different resources and many different references to see whether past research supported that there are social inequalities within our healthcare system based off of race. So from there, what I did is I took this data and I compiled it into a research project, which I'm currently using as my thesis. So what I'm doing is I wanted to see whether areas like insurance coverage, education, as well as food availability and health resources were equivalent between African Americans and Caucasians specifically. What I found is that there are many diseases as well as other struggles that tend to be easier for Caucasians, even within these underserved areas, than African Americans. So what I found specifically within the disease category is that African Americans tend to have higher disease rates than Caucasians, and this is shown in this image right here from the CDC. So what this is displaying is specifically diabetes and high blood pressure. You can see that African Americans have higher rates based off of the red bar above, and the blue bar shows Caucasian rates. So from this, you can see not only are there already higher rates within one race versus the other, but then you have to factor in the idea that there are still struggles to gain access to healthcare, health insurance, educational opportunities, as well as other social determinants that play a part in public health. It's really interesting as well that in the 21st century, we are still struggling with these issues. So what I would suggest for individuals is to keep your eyes open and apply aid that you can give to anyone, and do some more research on your own. See what your community is struggling with, and maybe you're able to help in a way that hasn't been met already by other resources. If you can find an area that you can improve or you can help even a few individuals, this will help to reduce the rates that we're seeing where African Americans and even Caucasians are struggling to meet these different social determinants of health and that are required for overall successful health. So if we can come together as a community and solve this issue and provide a little aid, then we can help our entire nation get better rates within these different social determinants of public health. Thank you.